I'm privileged today to be with Dr. Scott King from OSS Health. Today we're going to talk about why female athletes are more prone to ACL tears and ACL injuries. Dr. Scott, in these offices right here, you see these injuries all the time. Why do you think the female athlete is more prone to these kind of injuries?
So ACL injury is an injury to the ligament in the middle of the knee. It's your main stabilizer, or one of the main stabilizers in your knee. The female or young females especially are more prone to ACL injuries for multiple reasons. One reason is overall they're more flexible and they have more laxity to their joints, which makes them more susceptible to injuring their knee. The overall alignment of their lower extremities puts them at an increased risk. And then generally females have less strength, or their muscle strength in their legs might be lower or less than a male counterpart.
Now, I'm a dad. I have 3 daughters. One's done playing sports. She survived without having an ACL injury, but I have 2 younger daughters. What can I do? What can you recommend as a parent, or even the girls as athletes, do to help prevent the possibility of these kind of injuries?
It is very scary because if you look at a male and female, same sport, females can have an 8 times more risk of sustaining an ACL injury. So there are things that you can do to lower your risk. Maybe not necessarily prevent it, but you can certainly lower your risk. And those are strengthening and stretching exercises, a lot of core strengthening exercises, and then strengthening exercises focusing on the muscles in the back of the legs, like the buttock regions and the back of the thighs and your hamstrings. Also doing training on how you land and how you pivot, because all of that can be corrected and improved on, and that can certainly lower your risk.
What about the activity? I noticed today kids are not just in one sport at a time. They're going from travel soccer to AAU basketball practice, and then they're getting some softball hitting in between. Is the activity load too much? Is that contributing at all, do you think?
It can, because if you have fatigue, in your muscles, and you're doing, some kids will do like a soccer tournament one day and then they have basketball game at night, and so that kind of load can put you at an increased risk, because then your muscles weaken or they fatigue over time, and that puts more strain on your ligaments. So it can put you at more susceptible, it can make you more susceptible to an injury.
Dr. King, thank you for the advice. It helps parents like me. Guys, this is our OSS Health tip of the game.